Hello and welcome again, everyone. I'm Nikki from the Massachusetts Health Connector, and I'm joined by my colleague Thalia and our colleague from MassHealth, Abby, and they will be presenting today's information. In attendance, we also have Melissa from the Health Connector and Kate from MassHealth, who'll be supporting today's presentation by responding to your online questions as well as your questions that we take during Q&A. Together, all of us will be sharing information about the health and dental coverage options that are available for Massachusetts residents. Before we get started with the content, we'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar. This also includes our partners in the state legislature and our congressional delegation. So I wanted to share some information about today's presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 40 minutes, and then we'll have time for a question and answer period. If you'd like to ask a question at any time, please use the Q&A button at the bottom of your screen. There should be a ribbon that displays in Zoom. Use that and ask your question at any point in time. We'll be monitoring questions throughout the session. However, since we're expecting a large audience and several questions, we want to just acknowledge that we'll do our best to get through them. And if we don't get to your question directly, we might address your question when we're answering questions about a theme of questions. So please, as you enter any question into the Q&A, please feel free to scroll through the Q&A as your question may have already been answered or may have already been asked and answered by another individual. Now, when asking your questions, please do not share any personal information or private health information, as others on the webinar are able to see what you write. And if you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector and MassHealth customer service centers and instructions on how to find local help from an assister in your community. In addition, we are recording today's webinar. So following today's session, you'll get an email with a copy of the presentation, as well as a link to the recording. So there's no need to take detailed notes as you're going through. Essentially, we just want you to sit back, take in the information, and as you're hearing us discuss each part of this topic, if you have any questions, simply enter that into the Q&A. So with that, I am going to hand this over to my colleague, Thalia, to kick off the presentation.
Hi, and welcome everyone again. As the title of our presentation suggests, today's presentation will be focused on health and dental coverage options for Massachusetts residents who are losing or who might have already lost their employee-sponsored coverage and are exploring options for their health coverage. During today's presentation, we will go over the difference between MassHealth and the Health Connector, how we differ, and the populations that we serve. We will then move into some commonly asked questions for each organization. Then Abby will go over some application requirements as well as coverage options for MassHealth, and I will do the same for the Health Connector. Then we'll review some application deadlines for when you should apply for coverage. And lastly, we'll go over a few ways to get assistance with the application process. Okay. So now I will pass it over to Abby, and she will give us an overview of MassHealth.
Thank you. I'm Abby from MassHealth, and I'll just give you an overview of the populations we serve. So MassHealth provides health benefits for children, families, seniors, and people with disabilities living in the state. We also may pay for benefits directly, or we can also help pay for all or part of health insurance premiums. We cover doctor's visits, dental, prescription drugs, behavioral health services, and other important healthcare services. MassHealth is broken into two different types of populations. So we have individuals and families, and seniors and people needing long-term care. So for individuals and families, we think of those as folks who are under the age of 65 who are living in the community, so not going into a nursing home, and people of any age who are parents of children younger than 19, or if they're adult relatives of someone younger than 19. Seniors and people needing long-term care are folks who are over the age of 65 living at home. Folks of any age who need long-term care services in a medical institution or nursing facility, and individuals who are eligible for certain waivers or programs to receive long-term care at home, as well as members who are, so if you're applying as a couple and one person is under 65 and one person's over 65, you would use this application for those who are over 65. But for this presentation today, we're going to focus on our individuals and family populations.
And for those who are not familiar with the Health Connector, we are the state's health insurance marketplace, and we offer health insurance coverage to individuals, families, and small businesses. We offer coverage options to those who don't have access through their job or a spouse's job, or if you do not qualify for MassHealth. For those who have lost their health insurance through their employer, the Health Connector is an alternative to COBRA coverage. Those who come to the Health Connector might qualify for help paying for their coverage, and some may be eligible for $0 monthly premium payments. And although today we won't discuss this in detail, I did want to mention that Mass residents are also able to purchase dental coverage through the Health Connector, and we also have a separate platform called Health Connector for Business. This separate platform is for small businesses with 50 or less employees who are looking to provide their employees with health benefits. If you are interested in that, we do have a separate webinar for Health Connector for Business, and I can send those details if anyone is interested in that. So what we would like for you guys to take away from this section is that although MassHealth and the Health Connector work together, we are two separate organizations who share one application. That means that when you go to apply for coverage, you will only need to complete one application that will determine if you are eligible for MassHealth or the Health Connector. You do not need to specify which program you are applying for because the system will make that determination based on what you enter in your application. The application is also available in a couple of languages, including English, Spanish, and Portuguese, if that is your preferred language. So just to highlight the main differences between our organizations, MassHealth is the Massachusetts Medicaid and CHIP program. They provide free or low-cost health coverage to eligible individuals. Eligibility is based on income, age, disability, and other factors. It is administered by the state and funded by state and federal governments. And different from the Health Connector, they do have continuous enrollment throughout the year, meaning you do not have to wait for open enrollment to start your coverage. Now, the Health Connector is the online marketplace for insurance plans. You'll find plans available for all the leading carriers in Massachusetts on our platform, which will help you shop and compare your options all in one place. We have available plans for individuals, families, as well as small businesses. Eligibility is based on your income and your family size, and eligibility for subsidies varies. And the Health Connector does have timeframes and deadlines for enrollment, which are our open enrollment periods and our special enrollment periods. And now we'll go over some commonly asked questions for MassHealth as well as the Health Connector. And we'll start with the commonly asked questions for MassHealth.
Great. So we have 4 commonly asked questions here. So the first that we get often is, do you need to live in Massachusetts to apply for MassHealth? So yes, you need to be a resident of the state in order to apply for MassHealth. Being a resident means that you live in Massachusetts or you have intent to reside in the state. We do not consider residency if you are just here on vacation or if you're here to receive medical care in a setting that's not a nursing facility. Do you need to renew your MassHealth coverage? Yes. So you'll have to renew your MassHealth coverage every year once you get approved. In some cases, folks can be auto-renewed for coverage. So we'll use our electronic data sources and we'll be able to auto-renew you. You'll get a notice that says you're all set and you're auto-renewed. If you can't be auto-renewed, we'll send you a form in a blue envelope in order to renew your coverage. What happens if I get a new job or change my job? Please let us know. You can report this job change online using your MA login, which Talia covered in the beginning with the MA Health Connector, or you can complete a job update form and submit it to us. And then what do I do if my income changes throughout the year? So similarly, you can log in to your application and change that at any time online, or you can call us and report the change at customer service and they'll help you update your application.
So now we'll go over some Health Connector frequently asked questions. So first question is, are there other coverage options besides COBRA? Yes. So alternatives to COBRA could be MassHealth, if you're eligible, a plan through the Health Connector, or other group health plans like a spouse's plan through their employer, or you could also choose a plan directly from an insurance company. You could choose to go with COBRA if that is the best option for you and your family, but you might find that some of these other options might be more cost effective. Can I get help paying for my health insurance if I buy a plan outside of the Health Connector? So the answer to that is no. The only way that you can get assistance paying for your health insurance coverage is if you go through the Health Connector. Savings through the Health Connector could be through advanced premium tax credits or one of our Connector Care plans. Now, if you wanted to purchase health insurance through the Health Connector but not receive any assistance paying, you could also do that. It's still a great place to shop and compare plans since we do have all the leading carriers in Massachusetts available on our platform. Can I drop COBRA at any time and take up the Health Connector? So there are some circumstances when someone enrolled in COBRA can end the coverage and take up Health Connector coverage, including during the Health Connector's open enrollment, which starts in November, during a special enrollment period, which could be triggered by life changes like a change in your income, getting married, or having a baby. You could also switch over once a former employee's subsidies end or the full term of COBRA coverage ends. And the last question that we get is, if I get health insurance from my job, can I cancel my Health Connector coverage? And the answer to that is yes. Sometimes people use the Health Connector in between jobs or until they're able to get coverage from another source. Once you have coverage elsewhere, just make sure to call and cancel your coverage by the 23rd of the month. Okay, so we've briefly touched on COBRA a couple times during this presentation, but I just want to go through it on this chart so that the timeline and the options are laid out clearly for everyone. So first is loss of ESI. Once you lose your employee-sponsored insurance, which could be your last day of work or the last day of the month you were employed, you will trigger a special enrollment period that will allow you to get coverage with the Health Connector or MassHealth. Then there will be a 60-day election period. This part is important. You'll have a 60-day window to take action. This is 60 days before losing ESI coverage or 60 days after losing coverage. So you'll have a couple of options to choose from. One would be an alternative ESI plan for those under the age of 26. That could be joining your parents' health plan, or it could also mean joining your spouse's or partner's ESI plan. There's also COBRA, which will always be offered to employees and will allow you to stay on the current insurance you receive from your employer. The catch here is that you will be responsible for paying the full premium amount for this plan, which can get expensive. And then the last option on this chart is coverage with the Health Connector or MassHealth, depending on which you qualify for. Choosing between coverage options will all depend on your circumstance and what works best for you. For example, some employers will help with the cost of COBRA for a certain period of time, let's say 6 months. If you know you'll have alternative coverage within those 6 months, you might choose to go with COBRA. Just going to repeat this again because you don't want to miss that window. You'll have 60 days to take action. And after that, you might have to wait for coverage to get coverage elsewhere. So just start exploring your options now to see what is available. And now I will pass it back to Abby and she will go over some application requirements.
Okay, so like we mentioned earlier, but we just want to make sure that it is known. So the Health Connector and MassHealth for individuals and families have one application. So it's one application for two programs. You can apply online, which is the easiest and the quickest way, on mahealthconnector.org. And that will, like Talia said earlier, you don't have to choose which one you're applying for. Once you put in all your application information, it will let you know what you're eligible for. So who should apply? You should apply if you live in Massachusetts. So like we discussed earlier, you're a resident of Massachusetts. If you're a U.S. citizen, a U.S. national, or are otherwise lawfully present in the U.S. You can also apply if you do have Medicare or any other public health coverage. It is possible to be qualified for both Medicare and MassHealth. You can also apply if you're offered affordable health insurance from your employer. You still may be qualified for MassHealth, even if you have employer-sponsored health insurance. And you should also apply if you do not have health insurance. Do not apply for MassHealth, like we said earlier, if you're visiting for personal pleasure, like vacation, or if you're only in the state to receive medical care in a setting other than a nursing facility. So if you're eligible for other comprehensive health insurance like Medicaid or Medicare, you're not eligible for the Health Connector. And folks who are currently incarcerated can apply for MassHealth before their release, but they're not eligible for MassHealth or the Health Connector while they're in jail or prison. So who should be included on the application? This is probably the question that we get the most. So we just want to cover it pretty broadly. So we always reference to folks on the application as people in your household. So we'll ask you to tell us about your household members and who you live with. We do a lot of our application based on tax filing. So it's really important to think about who you file taxes with. So if you do file taxes, we need to know about everyone on your tax return. You don't have to file taxes in order to get MassHealth, but it's just a way that you can see that can help you fill out the application. So who you should include in your application. So yourself and your spouse, if you're married, any children under the age of 19, an unmarried partner who lives with you, if you also have children together under the age of 19. You should include their children that are under 19 if they also live with you, and then include anyone on your tax return, even if they don't live with you. You should also include anyone who you live with and take care of who is under the age of 19. And then who not to include. So you shouldn't include an unmarried partner unless you have children together. Don't include your unmarried partner's children unless they live with you or your unmarried partner includes them on their tax return. Your parents who live with you who file their own taxes. So if your elderly parents live with you, but they have their own tax return, you don't need to include them. Or if you are a young adult who live with your parents, but you file taxes separately, they don't have to be included. And then you don't have to include any other relatives who you don't claim as tax dependents. And then here's just a quick checklist of things we like to highlight for folks when they're applying to make sure you kind of have everything at your fingertips. So first and foremost is Social Security numbers. So you don't have to have a Social Security number to apply for MassHealth or the Health Connector, but if you do have one, we'll need to know what they are. You'll need your recent pay or income. So that includes copies of pay stubs or income or self-employment. We'll need proof of address, whether it's a copy of a lease, a mortgage, or a gas bill. We need immigration documents. So similar to Social Security number, you don't have to have immigration documents to apply for MassHealth, but if you do have them, please submit them because that will give you a chance of getting a better health benefit. And then information on any other health insurance you're enrolled in, so either Medicare or insurance from your job. As a reminder, you can still be able to be eligible for MassHealth even if you already have health insurance. So MassHealth and the Health Connector may be able to verify all of this information using our data sources, but we might ask for proof. So once you apply, you might get a letter saying we need proof of your social security number, and it will ask you what to provide and how to provide it. And also want to cover what's the best way to fill out your application to make sure it's complete and it has an easy way to be approved in a quicker fashion. So make sure that you answer all questions for all applicants listed on the application. So for yourself and anyone else that you include. When reporting your income, make sure to enter gross wages, weekly hours worked, as well as pay frequency. And also when reporting income, don't just say NA. Tell us how much it is, and if you have no income, just enter 0, and that will calculate within the system. Make sure to sign and date the end of your application. This is super important. So if you have a paper application, just make sure to sign the last page with the date. But if you're filling out online, it will get you to the last page, ask you to e-sign, and that will be the easiest way to submit. And then you can also apply over the phone. And while you're over the phone, they can take your verbal signature over the phone and they'll record it. If you need help when applying, we have a ton of help. So there's enrollment assisters that are in every community in the state, as well as there's 7 MassHealth enrollment centers across the state. We'll cover that in a later slide where you can walk in and ask for help with your application. And then, like I said earlier, after you submit your application, we'll attempt to match everything in our electronic data sources, but if we can't, we'll send you a request for information and ask you for those documents and for you to send it back to us. So make sure just to look out in your mail, and we'll give you a date to send them back to us by. And now what happens after you're approved? So once we get all the information, you send in any information we need from you, everything is approved, we'll make a decision. And if you are approved, you'll get a letter saying you're approved for MassHealth or the Health Connector and what specific benefit you're approved for. So first, if you're approved for MassHealth, you'll get a blue MassHealth ID card. So use this at your doctor's appointments so they can see that you have MassHealth. For certain MassHealth coverage types, you can enroll in a health plan. So you can go to masshealthchoices.com, and that can help you see where your doctors are and which health plan to enroll in. If you do then enroll in a health plan, you'll receive a white ID card from that health plan. So you'll show that with your blue MassHealth ID card at your doctor. So you'll show 2. If you have any changes like a job, your income, household size, immigration status, anything like that, make sure to let us know of those changes within 10 days that they happen. And then you will need to renew your coverage every year. So like I said, we'll either auto renew you or you'll receive a blue envelope in the mail. If you're approved for the Health Connector, you'll be able to compare plans directly on the online portal. You'll see carriers in your region and the monthly premiums associated with the plans. You can search to find preferred providers, facilities, and special medications that are covered in your plan. And once you compare the plans, you can decide, you can select a plan when you want to start and place it in your cart to check out. And then if you owe a premium, you have to make the premium payment on the 23rd of the month of coverage to the 23rd of the month for coverage to start the first day of the following month. Okay, so like I said, we'll cover some coverage types that we have for MassHealth. So this one's specific for MassHealth. So we have standard, common health, care plus, and family assistance. So these coverage types are the ones I mentioned earlier where you will enroll in a health plan. All of these offer a wide range of benefits and often depend on your circumstances and income. But if you're approved for any 4 of these, you can enroll in a health plan on MassHealth Choices, and that's when you'll get a white ID card as well. We also have MassHealth Limited, which provides emergency services for folks who have an immigration status that keeps them from getting other services. We have the Children's Medical Security Plan. So this provides coverage for primary and preventive medical and dental services to children who are uninsured and do not qualify for other types of mass health. And then also the Health Safety Net, which provides certain services at hospitals and community health centers. If you are a resident of Massachusetts and you don't have, if you aren't insured or you don't have minimal essential coverage.
Okay. So the plans offered through the Health Connector are a bit different. All the plans offered through the Health Connector meet state and federal standards for coverage, which means that you will get comprehensive coverage. When you shop through the Health Connector, you'll be assured that the plans covered offer essential benefits like preventative care, doctor's visits, hospital stays, and prescription medications. We offer qualified health and dental plans for all the leading insurance carriers in Massachusetts. The Health Connector is the only place where you can get help paying for coverage, and that can happen one of two ways, either through the advanced premium tax credits or through one of our connector care plans. With the advanced premium tax credits, you'll get help paying for your monthly premiums by taking those tax credits and sending them directly to the insurance company, so you don't have to worry about how that money is going to be sent to the carrier. It is sent directly by the IRS to the carrier. There is also our connector care plans for people in lower income ranges who meet other eligibility requirements. These connector care plans are low or no cost health insurance plans. So our connector care plans are unique to Massachusetts and have lower premiums, lower copays, and no deductibles. Eligibility for connector care plans are based on income and household size. So for an individual, the income limit for a connector care plan this year is $75,300. And then for a family of four, that limit is $156,000 this year. So if you do not meet these income limits, you might still have the opportunity to save on your coverage through the tax credits that I mentioned in the previous slide. Okay, so we're going to go over some deadlines for MassHealth and the Health Connector. So we always want to encourage people to apply for coverage, even if they are unsure which plans they qualify for, or if they've missed some of the deadlines. We say this because if you fill out the application and are found eligible for MassHealth, your coverage could start right away, since MassHealth does not have open and closed enrollment periods. Now, for the Health Connector, we do have enrollment deadlines. We are currently in our closed enrollment period. During this time, you'll need to have some type of qualifying life event that will open up a special enrollment period for you to shop for a plan with the Health Connector. Life events that could open up that special enrollment period include changes to your income, an address change, changing your immigration status, having a baby, or losing insurance through your job. You should also report any of these life events within 30 days of it happening, and then you'll have 60 days from that date of the life event to select a new plan. Payment and enrollment deadlines stay the same, even if you have a special enrollment period, meaning payment is due by the 23rd of the month, and coverage will start on the 1st of the following month. Okay, how to get help. So if you are seeking help with your MassHealth coverage, there are a couple of ways that you can reach them. You can contact MassHealth customer service at 800-841-2900. You can also visit a MassHealth enrollment center for in-person help, or you could use the appointment scheduler to schedule a phone or video call with a customer service representative. And for the Health Connector, the customer service number is 1-877-623-6765. You can also visit the web pages linked on this page that we will be sending to everyone for hours of operation and local events happening in Massachusetts, where the Health Connector will be available to some extent to assist you. On the local events page, you'll also find any upcoming webinars if you are interested in attending another webinar, either for individuals and families, or if you are interested in the Health Connector for Business platform. And I will pass it back to Abby.
So like I mentioned earlier, MassHealth has 7 enrollment centers throughout the state. So in Charlestown, Chelsea, Springfield, Taunton, Tewksbury, Quincy, and Worcester. So these enrollment centers are open for walk-in appointments. So you can walk in and ask for help with your application, and a MassHealth employee can help you. Please do not mail anything to these enrollment centers because they won't be able to be processed. So we included the processing center PO box here, which is also included on all our applications. Next slide. We also have community partners that offer in-person support. So there's free enrollment assistance that's available through our community partners across the state. They are trained and certified navigators and application counselors. They speak many languages, and they can help you apply and enroll in health insurance plans. They can answer any questions you have about MassHealth or the Health Connector, and you can call ahead to schedule an appointment. And the link, we can send the link out after, but if you just Google MassHealth or Health Connector enrollment assisters, you'll find the list, and you can filter it through your zip code.
And now we'll take any questions. I know that Nikki, Melissa, and Kate have been answering questions in the background.
Yeah, so we have lots of great questions. I've been answering some of them, and I know it seems like we have a couple of themes. So perhaps maybe I could start with something related to individuals losing access to employer-sponsored insurance, and knowing that today is June 25th, so people have they've missed the 23rd deadline. Could I hear from both the Health Connector and MassHealth just to talk about what someone should do in that situation? Because again, if you haven't applied, we don't know what you qualify for. So I will hand it over, Dalia, if you want to start, then hand it over to Abby. However you want to handle it, it's fine.
Yeah. So again, like I said in a previous slide, if you have missed the deadline, we would still want you to apply, because at this point you don't know what you're eligible, and MassHealth does not have an open or closed enrollment period. Your coverage could start as soon as tomorrow if that was the case, if you were eligible. But if it is that you are eligible for the Health Connector, I would say apply now, and then you would have time to get coverage for the following month. So unfortunately, you have missed the deadline, but that means that you'll have the opportunity next month to get coverage.
And Dalia, I want to add to that, because I know that for someone, so let's say it's not often that this happens, but sometimes it does happen, that someone loses coverage. Let's say they lost it June 20th, and they've just had a couple of days to get their things together. And they missed the 23rd deadline. If you can, go online, apply now, or call the Health Connector customer service line right now and ask for help in applying. Again, you don't know if you're going to qualify for MassHealth or the Health Connector, but if you do qualify for the Health Connector and you did just lose your employer-sponsored insurance, they might be able to retroactively get you enrolled for July 1. It's in very rare cases, but they may be able to help you do that. Just explain the timeline to them. But Abby, certainly happy to pass this over to you to talk about MassHealth a little bit.
Yeah, so like Talia said earlier, we have continuous enrollment. So it's not like the connector where you have to wait if you miss the 23rd. So if you're eligible for MassHealth, once you're approved, right now your insurance would most likely start 10 days before your application date. So even if you aren't approved right away, if it takes a week, or normally it doesn't take that long, especially if you apply online, but it would still retroactive 10 days prior to when you apply. So if you apply today, but you're approved next week, it would start June 15th. So that's a great way to be covered. I think, Nikki, one thing I also want to cover is some people asked in if you get if you do get penalized for not having insurance, which you only get penalized on your taxes if you do not have insurance for 3 or more consecutive months. So if it's a week or so, as much obviously we want everyone to be covered, but if it's a week or so, you don't have to worry that you would get penalized on your taxes at any point because of that.
Great. Thank you so much, both of you. And then Thalia, could I ask you to pull up your the flow chart that shows, we've got lots of questions about COBRA. So I just want to go over a couple of things or ask you to go over a couple of things. One theme I was seeing was just asking about exactly when somebody needs to apply so they know that they're losing access to employer-sponsored insurance. They're trying to understand like when they can apply for Health Connector coverage. And then there's a second part to this question where some people are getting some money from the current employer to pay for COBRA, but only for a short period of time. So I feel like those questions will be answered when you show the chart.
Sorry, I didn't realize I was muted. So yeah, I was busy looking at the listening to your question and looking for the chart at the same time. So I think the question was, when should they apply? If they know that they're losing coverage, I would say right away you can go on and start exploring your options. You can fill in the application, see what's available to you. Nothing is finalized until you make that payment on the 23rd of the month. So as soon as you know you're losing coverage, you can log into the application and see what is being offered to you. What was the second part of the question, Nikki?
Well, actually, I want to point something out that's on the chart. First, for some reason on our end, the chart looks blurry, and one of the attendees mentioned that. So when we send the deck out to folks, we send the presentation out to folks, we'll make sure that you're able to see this chart well. One detailed question was around the 60 days. So someone wanted clarification. They wanted to know if they had to tell us within 30 days. So maybe could you just read through that section because it's a little hard to see.
Yeah, give me 1 second. Maybe if I make it bigger, because it's very small on my screen as well.
Okay.
Yeah, sorry, I'm not even able to read it on my side.
Well, I can read it and then you tell me if there's it says 60-day election period. After losing ESI, you have 60 days to take action. That's either 60 days before or after after the loss of ESI. So at this point, I think one of the things you were talking about is remember that people have options. So it's your ESI that we're interested in or the ESI that you're enrolled in. So if you have a spouse or a partner or a parent's employer-sponsored insurance that you can enroll in, you should look into that. If your employer is offering COBRA, you can certainly look into COBRA and compare those options, but know that typically COBRA is much more expensive than shopping for coverage through the state's Health Connector. So just weigh your options before you choose. So the answer to the question really was they wanted to know if it was 30 or 60 days. They have a 60-day window. Leah, could you talk about different situations where somebody, like what if somebody is in COBRA and wants to drop it? Can you just talk about that for a little bit?
Yes. So if someone is in COBRA, they have decided to take COBRA, there are a couple of ways that you could essentially drop COBRA and come over to the Health Connector or MassHealth. And that's if you have some type of special enrollment period, which could be, I think that you mentioned this in the question, if the employer is paying a portion of the COBRA for a certain period of time, like I said before, maybe it's 6 months. Once your employer stops contributing to your COBRA coverage and now you're responsible for paying that full amount, that will open up a special enrollment period for you. And then you'll be able to come over to the Health Connector and get coverage. But if that is not the case, if let's say from the get, they never helped you pay for the coverage and now you have COBRA and you have realized you can't afford it, the only way you would be able to come over to the Health Connector is if you have another special qualifying an event, special enrollment period. And that could be change in income, change in address, any type of change. If you think it might open up a special enrollment period for you, I would say try and apply.
Okay, great. So essentially, losing access to an employer paying for COBRA will give somebody a qualifying life event.
Yes.
Or a special enrollment period. Okay. All right. I'm going to switch to, we can always come back to COBRA if people have more COBRA questions. I think we've touched on a lot of them. I want to switch to income because I feel like we had lots of questions about income. And this, again, this is open to Abby, Melissa, anyone who wants to talk about this. But we had some individuals who've lost their job. So they don't have that income from the job anymore. But now they're doing freelance work. They're just starting out and they don't have any income. So can we talk about how to report income on the application if they don't have any income right this moment?
Yeah, so Talia is showing a slide. So once you get the slide deck, you will see there's some slides in here that are specifically about reporting income. And I think it's important to just say that a lot of what you fill out on the application is asked to say what you think or what you might expect for the year. So for example, one question is, based on what you know today, how much do you think you will make in 2025? So you enter the total amount expected for the year. We always say make your best guess and make sure that you're using all of your different types. So it's really nice that it when you get to the screen, it goes through each type of income. So job, Social Security. I know there were some questions about if you get unemployment income, if you have things like capital gains or any sort of lottery winnings, things like that. You're able to go in case by case and put in what you have from those. And then if you don't have any income, you can just skip this page and continue without it. But I think the best way to kind of go through that is look at the questions because they'll help you answer given what you expect. So how much do you think you'll make during this year? Which obviously we're 6 months into the year. So if you've had a job, it won't be zero. So just make sure that you're making a best estimate. And then if we need more information, we'll ask you to provide anything like W-2s or pay stubs, things like that.
That's super helpful. And I'm sorry, Abby, I was checking on something else. If somebody's, and you may or may not have covered this, I just want to be really clear. If somebody needs to provide proof of income, what is it if they're self-employed? What is that called?
There's a self-employment form that you can fill out. I think Kate actually had put it in the chat. We have a bunch of links on how to do it, but there is a self-employment form that you can fill out to note your self-employment income.
Okay, great. Great. Let's see. So can we talk more about who to include on your application? Abby, would you want to start? And Thalia, Melissa, if there's anything you want to add?
Yeah, so this is definitely, I think, our most asked question. And the way that we like to kind of pose it, first and foremost, is about your taxes. So if you file taxes, you should really think about who is on that tax return. So you need to include every person that you have because they're in your tax filing household. So it's really important to look first at your taxes, see who's on it, and that would be included in your household. And then also, it's really important to start thinking about who then lives in your household. So we have the special circumstances of if you are taking care of someone younger than 19, if you do have an unmarried partner and then you have children together, and they have children. So that's an important way to look at who to include. I think importantly for not to include I think the two big factors that we talk about are if you are someone who has maybe elderly parents living with you, if you guys file separate taxes, you file one tax return and they file another, they don't have to be included because you're not claiming them as a dependent. And then also if you are a young adult, so maybe 19 to 26, and you live with your parents, but you don't you file your own tax return, they file their own tax returns, they're not claiming you, then you don't have to include your parents and they don't have to include you. So I think that that's a really good way to look at it is filing taxes and then make sure that even if you have adults that live with you, if you guys are filing taxes differently, then they don't have to be included in your household.
Okay, I have a follow-up to this.
Yes.
What happens if you have dependent children? They're going to college in the New England states. Should they be considered as intended to reside in Mass because they live in Mass when they aren't in school? So if I'm going back to what you said about your tax, like who are my tax dependents?
Yeah.
Okay, so I'll let you take it from here.
I think it's best to say if they're your tax dependents, you can include them. But one thing that we like to note is if they have MassHealth and they're not in this state, they can get emergency services. But other than that, if they have a doctor that they like to go to outside of the state, they wouldn't normally be covered. So I think that that's something to take into consideration is like if they're in another state and they have MassHealth, they can go to the emergency room. But other than that, they should really think about like what they're doing in that state because it might be best to apply through health insurance through their college if they offer it or through that state's Medicaid.
Okay, great. So I am going to skip to some marketplace questions. One question is about the kinds of plans that the Health Connector offers. So someone's asking if the Health Connector offers high deductible health plans. So either Thalia or Melissa, do you want to talk about the different kinds of plans that we offer and specifically talk about the catastrophic plans? I don't know if you have, I don't even remember we showed that slide. But if we could just explain who qualifies for catastrophic plans and what those limitations are. And if not, I'm happy to take that one. So you guys let me know.
We did not show that slide. I think it's in one of our other presentations. I know which one you're talking about.
Oh.
I'll let you take this one, Nikki.
Okay, no, that's fine. So we have all different kinds of plans for the Health Connector. Dalia has talked about how if you're looking to see if you qualify for savings, either through advanced premium tax credits or through state and federal advanced premium tax credits through our Connector Care program, you would be completing like the long application to see if in fact you could get some help paying for your monthly premiums. For somebody who is looking for a high deductible or what we call catastrophic health plans, which have like high deductible and higher cost sharing for services, but lower monthly premiums, those plans are limited to individuals who are 30 years of age or younger. So certainly could come onto the website, take a look. Also, if you really want to buy a high deductible health plan, you can also you can also apply for a waiver to be able to do that. So I hope that helps for that person. Hold on, I feel like there was some conflicting. Someone saying I'm confused. I got conflicting answers. Okay, so we're very, very sorry for any confusion that we might have caused you. Yes, the Health Connector has a monthly deadline of the 23rd. So for things to go smoothly and have you enrolled for coverage without issue on the first of the following month, we ask that you do everything before the 23rd of the month. If you are in a situation, because there are these situations where someone doesn't know that they're getting laid off, they find out on the 25th or the 26th that they no longer have a job. If somebody is in that situation, rather than having you go to the Office of Patient Protection, we ask that you go straight to our Health Connector customer service, and they can help you apply and explain when you're losing access to coverage. I hope that helps. I hope that helps clarify that. It's not that any of the other answers were incorrect. That's the path of least resistance. We typically host all of our webinars prior to the 23rd, but because we've got such a strong interest from individuals right now in getting this information, that's why we chose to offer even having this educational session on the 25th of the month. So if you're one of these people and you're in the situation that you're just finding out and you know your coverage is ending in a couple of days, definitely call customer service right now, tell them your situation, and apply. And as we said before, Abby, Kate, feel free to jump in. You're not even sure, you might actually qualify for a MassHealth plan. So this might, right? And Abby, you were saying if it turns out you qualify for MassHealth, you have the retro coverage as well.
Yep.
Okay, so I hope that clears up any confusion. All right, so sometimes we hear, so this is for anyone who wants to take it. We hear about people who are being required, people are being required to offer coverage or obtain coverage for children because of a divorce situation. I don't know if any of you can talk a little bit about that.
Yeah, I think I saw some questions on tax filing. So I know sometimes folks, one parent will file the children one year, one parent will file them the other year. It's just important to update every year, depending. So that's one thing you can do. And then also you can add someone anytime on your MassHealth. So if someone that you is living with that's under 19 who's starting to live with you, you can add them to your MassHealth household at any time, and it will recalculate your household size and everything like that and provide that person with coverage. So I think it's important for especially kids for that to kind of be just add them, and then you can update your tax filing household if it ever changes when you're up for renewal.
Okay, that's super helpful. And then in terms of income limits, I'm just wondering, Abby or Kate, could you talk a little bit about what the MassHealth income limits are?
So Kate, I think, put the link in the chat so it depends on household size and composition. So there we have a link in that we have that has it changes every year. So the current 2025 income standards and federal quality guidelines. And what you'll see is MassHealth income standards, and then you have the family size on the left, and then all different poverty levels. So that's just kind of like a quick glance that can help you get kind of situated with what that might be. Kate, do you have anything to add to that?
Yeah, I was just going to say, the only thing I was going to add to that was that income is not the only criteria. So it's really important to remember that while these figures are our standard, they are our threshold for MassHealth programs based on family size and income, there are other criteria that will qualify or disqualify you for the program.
Okay, that's super helpful. Could I introduce another dimension to this? Could we talk a little bit about Medicare? So sometimes we have, like families are coming to us and they're saying, okay, I have a spouse who is retiring from a position. They are going to enroll on Medicare. myself and the other people in my family don't have access to ESI anymore. I know, Abby, you said include all the people in the application who are in your tax filing household, but can you talk a little bit about how Medicare plays into this world?
Go ahead, Kate.
Oh, sure. Sorry. MassHealth is a payer of last resort. We are the last program. So anyone going on to Medicare, that person in that household will then consider Medicare their primary insurer. And then above and beyond that, to Abby's point, although they're going on to Medicare, they're still part of the household composition. So that person, including their spouse and any children that may have otherwise been covered under ESI and still qualify under the tax filing household, will need to be included on the application, whether or not they're applying. So the Medicare piece of it only pertains to the person receiving the Medicare. It has no impact on the other household members.
Okay, great. So essentially they're saying the person needs to be included on the application, but you're saying they're not applying for coverage because they have Medicare.
Correct. They could still apply for coverage, but will likely be denied unless there's other, like we said, qualifying circumstances that may get them some sort of supplemental plan. But that's a whole other rabbit hole.
Okay. And I was going to ask if one of my colleagues could put in the Q&A. We have an individual who believes that they bought a plan outside, so not through the marketplace, but they think they may have bought a scam plan. So I was just hoping we could give them the link to the Office of Patient Protection. But essentially, if somebody is trying to get health insurance coverage, they're outside the open enrollment period and they have extenuating circumstances, there is a waiver. There is a waiver that can help them apply and get coverage. So again, keep this in the back of your mind. I'm sorry, I do sound like a broken record. My apologies. You don't exactly know what you qualify for. So just apply. And then also keep in mind that throughout the year, circumstances can change. So I think when we were responding to some individuals' questions, we said, please remember to go in and update the application. And it is entirely feasible that someone could start the year off on MassHealth, have income changes, and go on to now qualify for a Health Connector plan. So I just want to make sure that people understand that they have that right and responsibility to update their income information and get a plan change during the year. And I see that we're really close to time. I guess I just want to ask my colleague, first of all, thank you all for staying on as long as you have. I know we've seen a lot of participants stay to the very end. It's 1 o'clock right now. But before we jump off, is there anything else anyone wants to share with those attendees before we sign off on this webinar?
I think just apply, like you said, Nikki. And if you use the online application, it will tell you which program you're qualified for.
Great. Thanks so much, Abby. Melissa, anything on the Health Connector side?
I would say go ahead and apply, like Abby said. And when you're in the application, if you feel confused, you need to stop. Everything gets saved exactly where you stop at. And we have customer service who can help you if you need additional help.
Great. Really, really great point. Sorry, I forgot to mention that today. So regardless of where you end up in the application, if you call customer service, either the Health Connectors or MassHealth, if you give them permission, they can go into your application, they'll get you over the finish line. So apologies as it's 1:01. I want to be mindful of your time. Thank you all so much for joining us today, and to all the team members, thank you so much for participating, presenting, sharing all your knowledge. Best of luck, everyone, and stay cool today. Take care.
Thank you.
Bye, everyone.